Hello, my name is Michele Dyogi. I'm a physical therapist and the director at the Breathing Center of Houston in Sugar Land, Texas. If you saw my last video, we explored the connection between posture and better breathing. The better your posture, the better your breathing. It makes sense. If your posture is good, then you can breathe deeper and thus feel less short of breath. Now I want to take it a step further. I want to explore the connection between shortness of breath and weak muscles. Think about this. Weak muscles use oxygen in a greedy way. Strong muscles, on the other hand, use oxygen like a well-oiled machine. They're so efficient, they don't use that much oxygen, or they use less with the same activity. But how do we improve our muscle mass to decrease our shortness of breath? Well, you have to think about the activity that you're using the muscles for. If it's walking, if it's going upstairs, or if it's standing for long periods of time to do cooking or laundry, then you're thinking about a lot of muscles, not only your trunk, your quads, your glutes. But today I'd like to just focus on the quads because those are that's a very large muscle group and it uses a lot of oxygen when you walk and when you get up from a chair. So let's focus on that today. If that sounds good, let's get started. Your first step is you want to scoot back in the chair. Scoot all the way back. Make sure your lower back is touching the back of the chair you're sitting in. Step 2, bring your foot onto another chair or a coffee table, something of equal height approximately. Set your timer for 2 minutes. Don't forget to set your timer. If you estimate, you will generally underestimate. Now work on your form. Bring your knee down as straight as you can. Even if it starts like this, bring it all the way down as far as you can. Should feel an intense stretch. If you don't feel an intense stretch, that's when you know you have to further refine your form. Bring your toes back. If you have to adjust your foot, that's fine. Bring your toes back while keeping your knee down. Squeeze that top of the leg, which is a quadricep muscle. Bring the toes ever back. If that's not challenging enough, turn the whole leg like a log in the water toward the inside of your body and feel the stretch perhaps going all the way up to your hip. If you're tight there, you're going to feel it pretty strongly. What we're looking for is a 6 out of 10 intensity of stretch. That's not too much, not too little, but just right. Make sure you're still able to smile and do this stretch. If not, pull back a little bit. You can bend your knee a little bit if you want to loosen the intensity, but I challenge you to go for gold. Really straighten it. Really bring your toes back. Really turn your leg in. And then, if that's not a 6 out of 10, hinge at the hips and lean forward. Ooh, that brought it to a 6 out of 10 for me. And you just hold. Don't bounce. After you find your good form, hold it there for a while. In this case, 15 more seconds. 2 minutes may seem like a long time, but it's over in a flash, and pretty soon you look forward to this time. 3, 2, 1. Okay, before stretching the other side, move your chair back and start kicking with the other side. Kick, hold, hold. Bring the leg back and rest. Kick, hold, hold, and rest. Kick to a straight leg, hold, hold, and rest. Kick, hold, hold, and rest. Focus on your breathing while you're relaxing. Perhaps do your stretches for the upper body. Depends on how coordinated you are. Or just enjoy. The nice thing is that once you get the form kind of established, you don't really have to concentrate on it very much. Your body kind of gets into muscle memory, especially the more you do it. And it becomes a habit to kick to a straight leg. But every day you do this, that quadricep muscle is going to get stronger and stronger. And when it does, it's going to impact your shortness of breath, causing it to go down with time. So trust in these exercises. And also work on strengthening your entire body if you can. Be active as you can be in your current state. 37 seconds left. Highly recommend a timer. We purchased these on Amazon. You can also use, if you have some kind of smart device, a watch, set your timer there, and then it's always with you. Ooh, my muscle's getting tired. How about yours? That's good, because we know we're changing something. We're improving something. Investing in ourselves. 2 more seconds. Okay. Mash on the timer. Set yourself up for your other leg. Get in the position. Oops, make sure that your posture was good. Step 1. Step 2, straight leg position for the stretch. And go. Bring your knee down. Bring your toes back. Roll your leg over to the inside. If that's not a 6 out of 10, hinge at the hips and lean forward. That might be pretty intense. Fun fact, in the clinic we find with time, we have our patients do this every day, at least at the Sugarland Clinic, and we find that sometimes little aches in the hips and in the back tend to loosen, not necessarily resolve, because sometimes it's arthritis or something that, is kind of a chronic condition. But decreasing the pull on those structures tends to help decrease pain. So these stretches can also be used for anyone who has knee pain or back pain, but consult your physician if you have any concerns, or ask them to write orders for physical therapy. Maybe it might help. 50 more seconds. Toes in, ever bringing your toes back, straightening your knee, leaning forward, but I can't because it's too hard. And that's okay, because we're not asking for perfection. We're just asking for better, and we're asking to invest in ourselves daily. 25 seconds. Breathe in, focus on your breathing. Connect to your breathing. Are you breathing in through your nose? Are you a mouth breather? Try to divert, if you are a mouth breather, divert your breathing through your nose. It's a higher quality inhalation. Okay, that's 2 minutes. Let's start kicking. Almost done. You're doing great. Kick, hold, all the way back. I'm starting to get hot. I guess I must be working out here, or these lights are hot. Kick, hold, bring it all the way back and rest. Make sure you rest. Otherwise, come 1.5 minutes, you might start to feel pretty sore in this area. And that's another thing. If you are wheelchair bound or have spent a lot of time in sitting, not necessarily wheelchair bound, but you may not have used this muscle in a while, and so you might experience a little bit of soreness as you start to make this a daily habit. Don't fear that. Embrace the change. Stay the course. Improve daily, and be kind to yourself. I like this exercise so much, I find it very relaxing, that I'll chat with my patients while we both do this together, because I love to realign my knee. I love to strengthen my quad, so I do it with them if I have an opportunity. Whew, starting to get tired. That's okay. You can do it. 32 seconds. The straightest leg possible, then all the way back and rest. Kick, hold, and rest. And breathe. In through the nose, big belly breath, and out through pursed lips. Or whatever type of breathing style works for you. That was the 2-minute mark. You did it. Well done. Thank you for joining me. This is Michele Dyogi at the Breathing Center of Houston in Sugar Land, Texas, wishing you good breath. Take care.